class, my name is Kelly Herman, and my presentation is on the effects of chronic mental illness on parenting. The problem of chronic mental illness can also be referred to as a serious mental illness. It's present in any individual 18 years or older who currently or within the past year has had a diagnosable mental, behavioral, or emotional disorder of sufficient duration to meet diagnostic criteria specified within the Diagnostic and Statistical Manual of Mental Health Disorders. A mental disorder is a syndrome characterized by clinical significant disturbance in an individual's cognition, emotional regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Mental disorders are usually associated with significant distress or disability in social, occupational, or other important activities. Chronic mental illness can have detrimental effects on parenting. Many individuals with mental illness have children, and a vast majority of the persons with mental illness identified as parents are women who bear an average of 1.9 to 2.4 children. Parenting is a substantial issue that needs to be addressed for women with mental illness. Lifetime rates ranging from 28 to 60% of mothers with serious mental illness lose custody of their children. Parents with mental health problems are more vulnerable, as are their children, to having parenting and child welfare concerns. So after reviewing some different literature, articles, and journals, I discovered that the history of chronic mental illness during the first half of the 20th century, individuals with mental illness spent their lives confined to institutions. So deinstitutionalization occurred and the availability of community-based treatment facilities, which produce ramifications for consumers, families, service providers, and society. A lot of this deinstitutionalization occurred around like 2000s, 2002. I know in Pennsylvania the state hospital was closed around that time, and a lot of these individuals were coming out of the hospital and they were going into group homes, and a lot of community services began in Pennsylvania around that time. So deinstitutionalization increased homelessness for these individuals, and it also increased criminalization. Policy and practice changes were developed to address the issues of deinstitutionalization. Family education was being provided, teaching the family about mental illness and their diagnoses. Support services were put in place. A lot of services were put into the community or put into the homes for these families or individuals struggling with chronic mental illness. There was an increased residential options. Again, group homes, residential treatment facilities, but they were really trying to get all the individuals with chronic mental illness out into the community. Housing supports were provided. That may mean that an individual was living in an apartment building and everybody was coming to them with their supports. They may have case managers coming in. They would be going to psych rehab or social rehab. Stricter laws regarding Medicare reimbursement were put into place, as well as jail diversion programs, psychosocial rehab, and vocational rehabilitation. The goal was to get these individuals working, so they're providing incentives through vocational programs, maybe going back to school, teaching them how to interview, all sorts of different things. Risk factors for mothers, parents struggling with chronic mental illness. A lot of these individuals, and a lot of the research is done just on the mothers, not so much the fathers, but a lot of these individuals live in poverty. They're divorced or they've never been married, and they're raising their children as single parents. They have a lack of social supports, and a lot of them lack the assistance from the child's father. Some have conflict with extended family, and they tend to live in adverse physical environments. This may mean that they're homeless. They're subjected to stressful life histories, such as childhood abuse. So many of them may have experienced traumatic events within their own childhood. More risk factors for mothers or parents struggling with chronic mental illness. Many often experience more negative recent life events, such as financial concerns, homelessness, etc. Parenting and childcare concerns are often ignored by their mental health providers. So if they are going in to receive care for their own mental illness, their providers aren't even asking them about any parenting concerns or asking about the children. There's inadequate mental health services due to lack of funding. So the accessibility of services for these individuals is very low in some areas. So what are the risk factors for the children of the parents diagnosed with chronic mental illness? A lot of the children have an increased risk of being placed in an alternative setting. It could be a residential treatment facility, group homes, or foster care. 1/3 to 1/2 will be diagnosed with their own mental health disorder. 58% of children with serious emotional disturbance have a family history of mental illness. 40% have a history of a parent who has had a psychiatric hospitalization. More risk factors for these children. They often express themselves. They have an increased negative behaviors. They don't know how to express themselves. They have emotional dysregulation. So this often leads to an increase in inappropriate punishment. They're acting out with negative behaviors. The parent is punishing inappropriately, which increases the negative behaviors, and the abuse cycle begins. There's often an increased risk of problems at school. Drug use can occur, poor social relationships, isolation from peers and community supports, and they live in unsuitable living environments to thrive. They may lack nutrition. Maybe their parent or mother, father isn't providing enough nutrition for them. So unfortunately, some of these children end up dying. Maltreatment can lead to fatalities. Biological parents are the most common perpetrators for fatalities. Females are more frequently responsible for deaths caused by neglect. 56% of parents working with Child Protective Services prior to a child fatality had a mental illness. Child victims are disproportionately born into homes with multiple risk factors and limited resources. Children whose parents or caregivers are emotionally disconnected elevate the risk of fatality. So what services can be put in place in order to help these children and these families? At a local level, each county within Pennsylvania has their own children and youth agency. These agencies can provide support to the child as well as the family. If needed, they will remove the child from the home, and they can help link the family to mental health services or have supervision provided within the home. Family and individual counseling can occur at the local level, trauma therapy, play therapy, support groups for children and parents, residential housing facilities if needed, crisis intervention services for both parents and children, as well as case management services. Housing services such as group homes or independent living, vocational programs, and medication management. These services can all be put in at the local level. At the state level, there's an organization called the Pennsylvania Family Support Alliance. This program informs and leads communities to action to protect children from abuse and neglect. There's information on their website for mandated reporters that explains how you need to report child abuse or neglect. There's services for parents or caregivers and children. There's different ways to advocate, and there's explanation of managed care funding and also services, so you can see what services may be covered. At the national level, we have the National Alliance on Mental Health, known as NAMI. This is an organization for individuals struggling with mental illness. They provide psychoeducational materials, they provide advocacy materials and advocate for different programs within the communities. They provide services such as free crisis support. You can text or call a hotline number if needed. There's different resources for housing, There's different conventions explaining mental health, as well as walks. They do NAMI walks in different areas, and that also helps to decrease the stigma. They're trying to decrease the stigma associated with mental illness. Prevention programs are also put in place at a national level. There's prevention programs for preventing reoccurrence of abuse and neglect, parent support groups, parenting classes and workshops, early intervention services. There's school-based prevention programs, family resource centers, and respite care. A lot of individuals with mental illness can benefit from respite care for their children to give them a break if they're feeling a little unstable. So how can we as social workers intervene to help this population at different levels? How can we help at the micro level, the meso level, as well as the macro level? At a micro level, we can intervene with case management services for both the parent and the child. We can assist with funding. We can help them to apply for medical assistance, apply for different programs that may provide grants within their community so they can get the services that they need. We can link them to community supports such as housing, food, mental health, transportation, social supports, recreational activities in their area in order to build those supports. At a micro level, we can provide individual therapy as well as family therapy. We can link the parents to different parenting programs or provide in-home parenting programs, as well as support groups. And for the child, they may be able to receive school social work. We can also implement evidence-based practices. Some examples of these practices include the acceptance and commitment therapy, otherwise known as ACT. We can implement alternative for families cognitive behavioral therapy. We can use family group decision making, where we bring all the family members together as well as supports within the family, extended family, to help make a decision to help this family. And they build upon their strengths within the family. It's a very strengths-based perspective program. We can implement family-centered treatment, as well as putting in-home prevention programs through Healthy Families of America in the homes. At a meso level, we can provide the family with community support groups, as well as school-based prevention programs. We can link them to community prevention programs, as well as psych rehabilitation and social rehabilitation programs. At a meso level, it's important that we get the family engaged in recreational programs within the community, as well as group therapy. At a macro level, we can advocate for funding of mental health services, and we can advocate for the continuation of prevention programs. We can support child abuse and neglect laws and policies, and we can advocate for new child abuse and neglect laws and policies. It's also important that we lobby to change ineffective policies and laws. So in conclusion, continued research is needed regarding interventions and treatment for parents struggling with chronic mental illness. There is definitely a need for family-focused treatment, and we also need to increase the mental health workers' awareness of the children and the parenting, and educate them about the patient's parenting role. We need to increase funding to meet the needs of the parents struggling with chronic mental illness. The accessibility of services needs improved to these parents and caregivers. Mental health professionals need to inquire about the needs of the children when meeting with the caregivers struggling with chronic mental illness. This would be an important part of the assessment process. We need to increase the supervision of families by the child welfare system. So these are all my references. And you can click on the different links to check out additional resources in different areas. This is the NAMI website, and this is the Pennsylvania Support Alliance Protection Children from Abuse.